This episode is sponsored by TherapyNotes, TherapyNotes.com. Be sure and check them out, and be sure and use the promo code Gordon, Gordon, and you can try them out for 2 months for free. Over 15 years ago, when I started my private practice, I had to learn a lot, and most of it the hard way, and I don't think you need to do the same. Hi, I'm Gordon Brewer, a licensed psychotherapist, and welcome to the Practice of Therapy podcast, part of the Psychcraft network of podcasts. Join me in this journey of discovery as we have conversations with other leaders and professionals in both the mental and allied health fields. Join us as we explore both the business and clinical sides of running a private practice. Hello, folks, and welcome to the podcast. This happens to be episode number 279 of the Practice of Therapy podcast. I'm Gordon Brewer, and glad you've joined us in this journey, and hope you will take time to follow the podcast wherever you might be listening to it. You know, in this particular episode, we really broach a topic that I've never gotten into before, and it's really more of, I guess you would classify as more of a clinical topic than a business topic, although there are some business implications for this. But anyway, I have my guest today is Jonathan Sabal, and Jonathan is the co-founder and CEO of Journey Clinical, which is a telehealth platform expanding access to psychedelic assisted psychotherapy. So there's been a lot of buzz around that and the effectiveness of it, things like ketamine and then psychedelic drugs that are being used in conjunction with psychotherapy, particularly for people that have chronic and persistent depression, also people with PTSD. Anyway, there's just been a lot more about that lately. I believe, if I remember correctly, the first studies about the use of psychedelics came out of Johns Hopkins in their medical school. So it's interesting stuff. You know, probably if you think back, of course, I'm aging myself. When we first heard about EMDR, and again, I'm aging myself, you know, there was a lot of skepticism about that, but it's a form of therapy that is effective for people, and we've learned a lot about it since then. But anyway, looking forward to you hearing my conversation with Jonathan. And before we get to that, I'd love for you to go check out the resources that we keep adding to over at the Practice of Therapy. And you can go to practiceoftherapy.com. You know, we've got some courses that we're offering. Google Workspace for Therapists is one of our more popular courses. Also, Money Matters in Private Practice. And we're constantly updating things and trying to stay on top of things, of keeping things updated. But anyway, I invite you to go over there and check those things out. There's also paperwork packets available, those kinds of things. Just go to the resources page at practiceoftherapy.com. And also, one of the things, as I've mentioned in previous episodes, that's been more of a focus for me this past year, and that is just really surrounding community and trying to build some different communities around particular different levels or different stages of private practice growth. I've got one, it's called the Practice Launch Club, and that's really mainly for people that are just getting started in private practice, of learning some of the basics and really getting a group of colleagues and community around building your practice, because it can be kind of a lonely thing if you don't have some help and community around that. And another one is just the group practice focus group that I have, and it's really geared more to those folks that might have smaller group practices that are also insurance based, which is the kind of practice that I have. And so again, it's a community that's there to support people in those journeys. And then also just the general practice of therapy community. And all of these are housed on the Circle platform. But if you'll go to practiceoftherapy.com/community, you can sign up for free for the Practice of Therapy community, and hope you'll join in some of the conversations that we're having there. So, yeah. So I commend all of that to you. And here real quickly, before we get to my conversation with Jonathan, I'd love for you to hear from one of the members of the Psychcraft Network, along with our sponsor, TherapyNotes.
Hi, everyone. I'm Aaron Potratz.
And I'm Nathan Hawkins. If you don't know us yet, we are the voices behind the Shrink Think podcast, which is part of the Psychcraft network of podcasts.
We are so proud to be a part of this network, along with the Kindness and Compassion podcast with Gordon Brewer, and the great work he is doing to help people in their journeys.
And if you haven't discovered the Shrink Think podcast, you can find us wherever you listen to your podcasts. We love for you to join us as we seek to help you with your relationships, your healthcare practices, and your therapy journey.
Join us as we bridge the gap between clients and therapists. Be sure to check us out at shrinkthink.com/podcast and take our free e-course.
One of the keys to a successful private practice is having the right systems and processes in place to make things run as smoothly as possible. With a system like TherapyNotes, you'll have more time to spend with what matters most, your clients. TherapyNotes is a complete practice management system with everything you need to manage patient records, schedule appointments, meet with patients remotely, create rich documentation, and bill insurance right at your fingertips. Their streamlined software is accessible wherever and whenever you need it. Your clinical records will be secure with less paperwork, which means you can give a much better quality of care. It's the EHR that Gordon uses in his practice. Be sure to check them out today by going to practiceoftherapy.com/therapynotes, and be sure to use the promo code GORDON to get 2 months free.
Well, hello, folks, and welcome again to the podcast. And I'm really looking forward to this conversation and you all listening in to my conversation with Jonathan Sabag. Welcome, Jonathan. As I start with everybody, usually on this podcast, tell folks a little bit more about yourself and how you've landed where you've landed.
Sure thing. So, I am from Switzerland originally, and I spent most of my career working in finance, where I built 2 businesses from the ground up. I had about a 20-year career in that space. But while I was building that first company, I actually suffered a very substantial burnout, which turned out to be the result of undiagnosed post-traumatic stress disorder. And so I really spent most of my adult life suffering from anxiety, depression, and substance abuse. About 8 years ago, I was on a downward spiral, and a friend of mine recommended I try ayahuasca. And so I had a traditional ayahuasca ceremony, and then I had 7 more in the span of 2 weeks. Mm-hmm. And I worked with that medicine for about 2 years. But after a while, I really felt like I wasn't able to process those experiences anymore. And so I seek the help of a therapist here in New York who worked with ketamine-assisted psychotherapy. And, we really started to build that bond, and that work was very helpful. And I was finally diagnosed with post-traumatic stress disorder, which was a huge relief, because having a condition that you don't quite understand is influencing your life in such a way, it was really very difficult, really. And so, that was very transformative. It helped me lead a much more normative life, but it also prompted a career pivot. I simply didn't feel connected to the work I was doing, and felt that I needed to do something that was more in line with who I was and what I wanted to bring to the world. And so I quit finance. And at the age of 38, I went back to school to study clinical psychology here in New York at the New School. And while I was in that process of becoming a clinician, I really felt the need to integrate all of those years of being an entrepreneur with my goal of bringing these medicines responsibly to the world. And so that's when I decided to found Journey Clinical, along with my wife, actually.
Mm-hmm. Oh, that's great. Yeah, it's what's interesting to me is the fact that, and this is a theme I hear from a lot of folks here on this podcast, particularly in this mental health therapy world, is we go into it because of our own life experiences and the transformations that we've experienced ourselves through different models and different ways of doing all of this.
100%. I think that this is a very common theme in the world of psychedelics and mental health as a whole. I think it's often a second career.
Mm-hmm.
What my belief is that I think that we, through this process of self-discovery, we change, but we also don't really change. I think we are, as we are, and we learn how to accept ourselves and rediscover ourselves in a different lens and shift our perspective on our experiences.
Mm-hmm.
And so it's probably only natural that we go back also to, our prior inclinations and what we enjoy doing, but with a different perspective. And I feel that's very much been the case for me, at least in my life.
Yes. And I think you hit on something that I think is universal and just in this in these helping professions is that we help people see the world through a different lens. And that's really, if we were to cut away all the different theories, all the different things, that's kind of the goal of whichever way you get there. So, yeah. So, well, I know one of the things this is, I think a lot of us in this field have been reading and hearing a lot more about psychedelics and the use of that, especially to treat really chronic conditions. Tell us what you've learned and how you kind of got started with Journey Clinical.
For sure. I mean, maybe like for context, just reminding, where we're at in the world with psychedelics and why there's such a topic of conversation today. For the past 50 years, there hasn't been any kind of innovation in the field of psychotherapy. It's been very much going back to a traditional mode of therapy and medication management with SSRIs in a pretty disjointed way, actually, where people are seeing a prescriber and then seeing a therapist. And there's also no collaboration between those two parties. And, in the 60s, there was an advent of research on psychedelic assisted psychotherapy at Harvard and other institutions. But, the Nixon administration really put an end to that. And so in recent years, in the last 10 years, psychedelics have come back to the forefront. MAPS did a tremendous amount of work to work with the DEA and to get MDMA in clinical trials for the treatment of post-traumatic stress disorder. They're in phase 3 clinical trials. They achieved breakthrough status from the FDA. There are also, other companies like Compass Pathways and Usona that got psilocybin, which is the active component of magic mushrooms, in phase 2 clinical trials, and also received a breakthrough status from the FDA for the treatment of depression. And there are countless amounts of drugs being developed right now. A lot of money has poured in an investment to that sector. And so, the other compound that has been used actually quite actively is ketamine. And so, ketamine is a dissociative anesthetic. It has properties of regulating glutamate and the central nervous system. It also helps increase neuroplasticities, so do other psychedelics. And so ketamine, has been an FDA-approved drug since 1970. It is on the WHO top 10 list of medications to have. It's very frequently used in emergency rooms for people who are highly suicidal to reduce those symptoms. And there's a tremendous amount of research that has shown that it's very effective to treat anxiety and depression. And actually in the 90s, a gentleman called Evgeny Krupitsky was working to treat alcoholism with ketamine. And so that got brought over. And so in recent years, it was used in, IV clinics, simply using the neurological components of ketamine and not really considering the, dissociation or the psychedelic effect. And so you'd had patients that were working with ketamine that had tremendous psychedelic experiences, very cathartic. They didn't quite know what to do with it. And so that's when, the idea of bringing that to the model that MAPS and Compass Pathway are doing, which is psychedelic assisted psychotherapy, came into play. And so just at a high level, what is psychedelic assisted psychotherapy? It is essentially the idea that you're incorporating these treatments in a practice as an adjunct to therapy, that this is a treatment that works with a therapist where there is preparation sessions. In those preparation sessions, a therapist will work with a patient to describe what to expect, to manage expectations. That's something that's not said enough, but people go into these sessions with sometimes an idea that they're going to have a breakthrough experience or a very big ego dissolution, but actually working with people to work on that transference to the medicine and to bring mindful attention to whatever unfolds without an expectation is a big part of preparation. Then you have something called the dosing session. In the dosing session, the patient will be administered the drug in the presence of a therapist and have that session, which can be at a higher dose psychedelic, at a lower dose psycholytic, which means that they have more interaction with the therapist. And then the integration work. And the integration work is really, really important because that's where process all of the information during that window of about 7 days of neuroplasticity. And a lot of studies have found that actually it's through integration that long-term behavioral change happens. So that's at a high level what's going on in the psychedelic space today.
Right.
Yeah.
Yeah, go ahead. This is just fascinating to me. Yeah.
And so, what we landed on at Journey Clinical is that for us, the best path to essentially ensuring mainstream adoption of these treatments and delivering them at scale to patients responsibly and sustainably was to empower licensed mental health professionals to incorporate them in their practice as an adjunct to therapy, very much like EMDR. And, the reason for that is they're embedded in local communities, they have a relationship with that patient population, but more importantly, they have a really strong therapeutic alliance that they develop through maybe years of therapy with their patients. And so what we started to look at was what is the main barrier to entry for therapists to incorporate these treatments in their practice. And what we found was forming and maintaining relationships with prescribing physicians is actually the main barrier to entry. We actually surveyed 600 therapists, and that really is what came up as the number one issue. And, I don't know if you know this, but there's actually only 25,000 psychiatrists in America. They're mostly located in large cities, and most of them are not psychedelically informed. There's a similar shortage of psychiatric nurse practitioners, and people see that often when they're trying to get medication management. They put on wait lists. It's very, very problematic.
Oh, yeah.
And so, what we landed on is that essentially supplying them with that resource is really what is the main need. And so, what's going on right now is that they're either referring out to chain clinics or direct to consumer platforms where there really isn't any kind of therapy. They're simply sending the patient ketamines. Or when they do have that kind of relationship, they're fickle. It puts a lot of pressure on the pricing for the patient, and it really limits the revenue potential of growing their practice for the therapist. And that's not ideal, right? So if you're spending years with a therapist, working to build a therapeutic alliance, and all of a sudden you're being handed off to someone you've never met or an app, that's clearly not the best patient experience. And so it's important to understand what we do at Journey Clinical. We're not an online ketamine clinic. We are essentially building a back-end infrastructure solution to allow for therapists to incorporate these treatments in their practice. We are the necessary infrastructure for psychedelic assisted psychotherapy to exist. And so practically how that works is that we set them up with everything they need to incorporate, first ketamine, because that's what's FDA approved, in their practice. So it works practically by supporting a collaborative care model where therapists join Journey Clinical. They refer their patients to our in-house medical team. We have a 30-person medical team. We see those patients for a full hour intake. We'll assess eligibility, we'll track outcomes, and we'll do a prescription. If they're eligible, we'll send them an offer 2 ketamine sessions that they can do in a variety of modalities. We support at home, in person, remote, group remotes, retreat formats, and I think we're supporting as well couples therapy. And all of this is delivered by the therapist. So the therapist is the one delivering the dosing session. And the reason why we've got so many modalities is that it's really important to offer flexibility to the therapist based on how their practice wants to be run. But also patients might want to start with one modality with their therapist and progress to another. And so then the patient will come back within a month for dose adjustments, and we'll see them regularly for follow-up consultations. On the therapist side, and I think this is really what we're offering, it's not ketamine prescriptions. It's what we're offering is this collaborative care model where we become the therapist's in-house doctor. And so basically, they're getting access 24/7 to a world-class medical team, just like if they're working for a large clinic or hospital system. And we're there to support them when there is a difficult experience, and they do happen. We're here to support the therapist and the patient and really triangulate, and that really mitigates negative outcomes. But we're also here to collaborate on an ongoing basis with the therapist who is seeing, who has the best exposure to the patient's progress, to understand how that treatment is impacting the patient, so that we can essentially build bespoke treatment plans at scale. So we're basically building concierge mental health at scale. And all this is tech enabled. We've got a tech portal where our prescribers have basically what is an EMR. Our member therapists have a member portal. On that portal, there is a 22 training module that Fluence developed. They get CE credits for that for ketamine training. We have experiential learning. We have peer consultation groups. We have the ability for therapists to have a CAP experience with other members. We give them a library of resources. We give them marketing office hours. I mean, there's a lot of offerings there, and they refer their patients through the portal. They can track the patient outcomes through the portal, and the patients have a portal. So that's at a high level. I threw a lot at you.
Oh, that's So
what we're doing.
So what would if people that are listening to the podcast, I would imagine there are people that say, yeah, I'd really love to be able to offer this to our patients. What is the training process like for the therapist on that side? Because I dare say for a lot of folks, this sounds really maybe kind of intimidating without really kind of any prior knowledge of, okay, how do I navigate these types of sessions? How does all of that work? Yeah.
That's a great question. So first of all, it's important to note that we only work with licensed mental health professionals. So they're already very equipped to be able to navigate any kind of cathartic experience. And so bringing that knowledge that they've developed over years of studying and training and practicing therapy is a tremendous asset in this context, right? So that's already something that we've seen a lot of our therapists, get comfortable with. And, we've got almost 800 of them in our network today. And so the other part is that they can join Journey. And on our portal, there is a full, educational offering where they have 22 modules on ketamine-assisted psychotherapy. There's another 22 module training on preparation and integration. We offer them peer consultation groups with other members. There's experiential training. So if they want to have a CAP experience, they can experience it with other Journey members. There are, we put a lot of content out there. So we have SMEs that come and talk about IFS and CAP, or EMDR and CAP, or Gestalt and CAP. I mean, we've got a tremendous amount of information available to them through the form of live webinars or peer or expert-led consultation groups. We have a huge community offering. Like, something that people tend to forget is that, it's a lonely job to be a therapist. And so having access to a community of peers who are there to support you and who have done this before is a tremendous value. And so we really have, we have local meetups with our members. There are specialized groups on, LGBTQI and psychedelics, or we're doing one on not postmortem. What do you say? When, it's after birth, it's postpartum and CAP. So we really work on delivering continuous content. We also help them with resources on scope of practice with lawyers. consent to touch. So basically all they need to do is join Journey, go through our process, and it usually takes them about a month to go through the education, and then they can start referring patients. And to date, we have 800 therapists in our network. We've seen close to 2,000 patients. And I saw a really interesting number is that in the last 10 months, our therapists have delivered more than 3,500 CAP sessions.
Wow. Wow. Are you running into any problems with, unfortunately here in the US, there's not a whole lot of licensure portability that's there in terms of state restrictions or that sort of thing for offering this type of service to people?
That's a very good question. So again, you have to break it down on what's happening here. A therapist is referring a patient to our medical team. Our medical team is responsible for eligibility, prescriptions, and outcome monitoring. So anything linked to the ketamine itself lies with Journey Clinical. We're the ones taking on the medical legal liability here.
Right. Okay.
The therapist is only delivering a psychotherapy session. That's it. They're not administering the drugs. They're not making any kind of decisions on eligibility or treatment plan. And they're not even administering blood pressure cuff. That's the patients are doing that themselves. So the therapist really is only reporting the session in our portal. And so that falls completely within the scope of practice of any licensed mental health professional in any state. We have a whole webinar that we actually deliver on this topic. And so even some of these sessions can be reimbursed by insurance because, they are a therapy session, or at least part in and out of network, really.
Right. So with one question that might come up for people is with, I guess ketamine assisted or psychedelic kinds of things, are there situations where it's contraindicated? I would think that, that comes up a good bit as well.
Of course, that's a very important question. So I don't believe psychedelics are for everybody. They're not a panacea. Unfortunately, there is a very large population of people that do qualify for this treatment today. And there are counterindications that are, chronic cystitis, high blood pressure, other medical conditions that might be counterindicated, personality disorders, someone who's having a manic episode and who's bipolar and having a manic episode might not be appropriate. Bipolar depression, however, does work with ketamine. So there's a spectrum. And so we do all of that work. We essentially do a full medical evaluation, a full psychiatric evaluation. And in the cases where, for example, someone suffers from high blood pressure, we'll ask the patients to get clearance from their primary care provider or their cardiologist or whatever applies for that condition. So we're very thorough in essentially assessing eligibility.
Yes. So with another question that I'm sure will come up for people is billing and how that's handled, like with insurance companies and all of that sort of thing.
Yeah, great question. So at Journey Clinical right now, we are out of network. So we do provide super bills, but the treatment on our end is quite cheap. We only charge $250 for an intake and $150 for a follow-up consultation. The ketamine itself cannot be covered by insurance because it's an off-label prescription. However, the therapy is therapy. So they can code those sessions as therapy sessions. The dosing sessions are a little bit longer. So at least part of that can be coded as a therapy session, and it can be in network or out of network. We do help with those codes, but they're traditional therapy sessions.
Right. And I asked that question mainly because I know there are a lot of folks out there that are insurance based. I was thinking, my practice is insurance based, and so that would be something to work out. But I think for somebody that maybe has a cash based practice, this would be a great fit and add on and that sort of thing for the work they're doing. Yeah.
It also works if you're insurance based because part of those sessions are coded as psychotherapy sessions. So there's no special code that needs to be put in place for CAP. It's an hour therapy session, right?
Sure.
The CAP session itself is longer. So that's the one where it's about 2 hours.
Okay. Yeah. So that makes sense. That makes sense to do that. So just thinking the logistics of it. So somebody decides to do this type of session, what does that look like logistically for somebody maybe on the local end? Does the patient or the client come in with the ketamine in hand and then they start? Do we do a video link with Sherney? Yeah, just those kinds of questions. Yeah.
Yeah, that's a great question. So we provide a tremendous amount of resources for both the therapist and the patient to get ready before the session and explain how it's going to unfold. And so the way it works is that the patient will have a preparation session with a therapist that can be in person or remote. Then that's an hour session, a normal therapy session. Once they're ready with that, they receive their ketamine, they will come. Then there's a variety of modalities, right? So if it's at home, for example, we have a protocol where the therapist will do a preparation session before. The patient will self-administer the ketamine at home, and then the therapist will have to vet. So there has to be a chaperone at home that's around, and that chaperone can be picked by the patient, but the therapist has to vet the patient. Has to vet the chaperone before. You don't want someone who is having an argument with their spouse to have that spouse be angry and walk into the room while they're having that session, or maybe activates the patient. And then the therapist will check in with the patient before the session. The patient can self-administer the ketamine alone with the chaperone in another room, and then the therapist checks in after, and then the therapist will do the integration session. So that's the essentially self-led protocol. Then we have virtual protocol, so remote, where just like you and I are on Zoom, the patient will have the same preparation. They will self-administer the ketamine at home with the chaperone, and the therapist will be on Zoom with the patient. There is a in-person, so in that case, the same process applies, but the patient will come to the therapist's office, self-administer the ketamine, the self-administer a blood pressure cuff before the session and after, and then self-administer the ketamine, and then the patient will have a chaperone come and pick them up from the therapist office. We always recommend, we ask that as a requirement. And then there are, the ability to do this in group sessions. It can be in couple sessions. It can be we have some members who actually deliver retreats. We have a member who bought 2 pieces of land because she's been doing so well and delivers weekend retreats for patients who come in a group setting. So there's a variety of modalities, but the format is always the same. The patient receives the ketamine at home, self-administers the drug, for the session, and the therapist delivers the therapy.
Right. What sort of additional liability insurance or that sort of thing might be needed with this?
Yeah, so no additional liability insurance is needed because, again, if you look at patients who take SSRIs or anxiety medication, those or who are on Suboxone and are having a therapy session, there's no difference here, right? Essentially, the patient is taking a medication prescribed to them by a medical professional for a specific condition and having a therapy session. From a liability perspective and from a malpractice perspective, there is no difference there whatsoever. So there's no special requirement. If therapists want to have additional protection, what they can do is get a general liability insurance on top of that. If they're scared of someone falling and hurting themselves or things like that.
Yeah, that makes sense. Well, Jonathan, this is fascinating stuff. One other question I was just wondering is, and just thinking about the business sides of things, what are you finding that people are, how it's benefiting them financially at these kinds of add-ons?
Yeah, that's a very good question. So what we found is that, members who work with us and who are really successful build a whole CAP practice. I mean, they have wait lists and really are able to build out a whole offering. There is 40 million people in therapy today. A large percent of those people are suffering from anxiety, depression. And so those patients are applicable. And so we really help therapists through the process of talking about it with their patients, of getting it out there in their local communities. We give them, content to put on their website. They have a Journey Clinical badge because a lot of people view us as a standard of quality that they put on their social media. We help them outreach to their patients. So we really support them in building out their practice. And what we found is that this can be an extremely lucrative offering to add to their practice. We have some people who are in even smaller communities in more rural areas. And so there's not so many providers available out there. And as soon as word gets out, they get really, really full. So with a little bit of effort, and we really help them through that. Once that gets going and, through word of mouth, it really can really grow their practice very quickly.
Wow. Yeah. Yeah. That's, again, one of the tying in the business side of it, I think is, part of what this podcast is about, is just being able to make those connections there with, looking at ways to diversify your income, first diversify your reach, being able to be more effective as a therapist and being able to genuinely help people in different ways, which I think is really important. Yeah.
Absolutely. And, that's our whole business model. What we wanted to do is essentially bake into our business model a virtuous cycle where if our therapists do well, our business does well. And so that's really everything we focus on. It's also why we decided to focus on the therapist as our main customer, because, by supporting their practice, that's how we get to the most people sustainably. So we're all about supporting them, helping them build out their practice, giving them the tools. We give them handouts. I know it can be challenging to do that, but we've done it very successfully multiple times over. As I said, we grew to 800 people in less than 10 months, and it's growing very rapidly. And all of those therapists are really being able to build out their practice, learn from other therapists in our network who have done it successfully, come for advice. We give them resources. So it's doable and it works in that way.
Awesome. Well, Jonathan, tell folks how they can find you and find out more about Journey Clinic.
Sure thing. So they can go to our website, journeyclinical.com, and set up an appointment with our team, and someone will be happy to give them an explanation of the offering, a demo of our platform, and help them on board.
Awesome. I hope maybe we can have another conversation about all of this and the things that we learn on the clinical side with this modality.
I would love that. That'd be a lot of fun. Thank you.
All right. Thanks. Well, again, a big thanks to Jonathan for being on the podcast. And this was just a fascinating conversation and just thinking about the ways in which we can help people access stuff. Particularly, I think most of us have had clients that have, things like persistent depression or other mental health issues, and it just seems like they're not making any progress with just kind of the traditional medicines and forms of doing treatment. And so I think this is something for us to learn more about. And I'm glad that there's a lot more research into these alternative forms of treatment for mental health. I'm not advocating it one way or the other, but I would just say, it's interesting stuff. And so I think it's going to be helpful for all of us to find out more about it and learn as much as we can about these other modalities of treatment. So you can check them out at journeyclinical.com and find out more about it. And also I'd love for you to come over and just visit our website, practiceoftherapy.com, and check out all the resources that we have there. I'm constantly looking for new resources and ways to help people in their private practice journey, and constantly updating things as well. So be sure and check it out. And also big thanks to our sponsor of the podcast, TherapyNotes. You can find out more about them by going to practiceoftherapy.com/therapynotes and use the promo code Gordon, just GORDON, and try them out for 2 months for free. They're who I use in my practice and absolutely love all the things that they're adding now. They've got some tests and some assessments available now automatically through their platform. So that's pretty cool. I'm going to be checking those out here soon. So that's it for this particular episode. Take care, folks, and I hope you'll come back for more. And do take time to follow us wherever you might be listening to your podcasts. And we've got a lot of great guests coming up. So take care, folks. You've been listening to the Practice of Therapy podcast with Gordon Brewer, part of the Psychcraft network of podcasts. You can find out more about the other great podcasts in the network by visiting psychcraftnetwork.com. And if you haven't done so already, please visit us at practiceoftherapy.com and get your free private practice startup guide, along with a lot of other great resources and webinars and free things just by visiting. Also, be sure to follow us wherever you might be listening to your podcasts. This podcast is intended to be educational in purpose and is not intended to give legal, accounting, or counseling advice. If you need a professional, find the right person for that.